This video, I'm going to talk about the vertebral artery. Vertebral artery is considered as part of the posterior circulation of the brain. What does it mean to be considered as part of the posterior circulation of the brain? It means that it supplies all the contents in the posterior fossa. And the contents in the posterior fossa can include your brainstem, including midbrain and pons and medulla, most importantly the medulla, the cerebellum. The vertebral artery is considered the first branch that arises from an artery called the subclavian artery. If you look here, we're looking at the right side of the neck, and you can see something called the brachiocephalic artery or the innominate artery, which arises from the aortic arch. This will give rise to two branches. It's a very short branch, so we'll divide into the common carotid artery, which is part of the anterior circulation, and also the vertebral artery, as you can see here, which is part of the posterior circulation. So the vertebral artery is the first branch of the subclavian artery. Usually the first branch. Sometimes it's not, but usually the first branch of the subclavian artery. As you can see here, we have two vertebral arteries. That's one on the right side and one on the left side. But you can see the big difference here. So I want you to look at this diagram, which shows that you have quite thick left vertebral artery and a relatively thin right vertebral artery. And this explains the dominance of the vertebral artery. So most of the times you will have patients with right vertebral artery dominant or left vertebral artery dominant. So the right side is hypoplastic in about 10% of the population, and the left side is hypoplastic in the 5% of the population. So this is in about 10% of the population you will have the right vertebral artery is hypoplastic. So to be able to study the vertebral artery, so basically we're going to focus on 3 points as always. So the 3 points are what's the origin, and we talked about that it arises from the first branch of the subclavian artery, and 2, what are the segments, and 3, what are the branches of the vertebral artery. Segments, vertebral artery is divided into 4 segments: V1, V2, V3 and V4. We have quite nice diagrams for each segment of the vertebral artery. So first of all, looking at this one. So segment number 1, it comes from the origin all the way up to the transverse foramen of C6. All right. So just to orientate, here is anterior, here is posterior, and you have all the vertebrae here starting from the atlas all the way up. So this is the atlas, and second, third, fourth, fifth, and sixth vertebra. So this is the transverse foramen or foramen transversarium of the C6. So V1, it starts from the origin and goes all the way up the transverse foramen of C6. And V2 is intraforaminal. So it will be from the transverse foramen of C6 all the way up to the transverse foramen of the atlas. And then V3, so this is V2. And then V3 will be from transverse foramen of the atlas and will curve backward until the edge of the foramen magnum. And then V4 will be basically inside or intracranial or intradural. We're going to study each one separately now. But this is just a quick explanation that we have 4 segments. We have 4 segments of the vertebral artery. So we explained that V1 is called the prevertebral, just before the vertebrae. And from the origin, which is the subclavian artery, all the way up and posteriorly to enter the transverse foramen or foramen transversarium of the C6. V2, as you can see here, is intraforaminal. From V2 is intraforaminal. So from the transverse foramen of C6 all the way up to the transverse foramen of C1. So it ascends vertically within the transverse foramina of the cervical vertebra, and it's usually surrounded by sympathetic fibers coming from the stellate ganglion and also venous plexuses. It's situated anterior to the cervical roots, so the cervical roots will be behind the vertebral artery, and it turns laterally to enter the foramen within the transverse process of the axis. So while it's coming here, it will move just a little bit, a tiny bit laterally, and this is relevant surgically when you're senting screws. And then V3 is basically this curve on the posterior arch. So there is a groove here. So this is the vertebral artery groove or impression on the posterior arch of the atlas. So it exits the foramen of the axis and curves posteriorly and medially in a groove of the upper surface of the atlas to enter the foramen magnum. So now it's entering, going up to enter the foramen magnum. V4 is basically just it entered the foramen magnum, so it pierces the dura. So this is the only intradural segment immediately into the subarachnoid space, and at the end it will join the vertebral artery on the other side or basilar artery. All right. So just a quick summary. So as you can see here, they join together, right? So they will come from foramen magnum and into the subarachnoid space, join together to form the basilar artery. So vertebral artery again, it's the first branch of the subclavian artery, and it divided into 4 segments. V1 from from the origin to transverse foramen of C6. V2 from the transverse foramen of C6 all the way up to transverse foramen of C1. And V3, that's the curve on the posterior arch of C1. And V4, it's the only interdural segment, and it pierces the dura or foramen magnum to join the other vertebral artery to form the basilar artery. So the last bit to cover here are the branches of the vertebral artery. It's simple if you want to remember this. So basically, you have meningeal branches, and you have medullary branch, and you have a spinal. So you have anterior meningeal and posterior meningeal, medullary artery, and anterior spinal and posterior spinal. But the most important and the largest branch is the PICA, the posterior inferior cerebellar artery. Let's look into that. So from the, you're looking here at all the blood vessels at the base of the brain. So you have one vertebral there and one vertebral on the other side. So these are the two vertebral arteries. They're coming together through the foramen magnum to form the basilar artery. So you have a branch here. This is called the PICA, or the posterior inferior cerebellar artery. From the name, it will supply the cerebellum. And also you have the anterior spinal artery. Anterior spinal artery. You're very close to the medulla oblongata, so it will also give some medullary branches to the medulla oblongata. Sorry, a medullary branch, anterior spinal, posterior spinal arteries also will give anterior meningeal and posterior meningeal branches, and the PICA, or the posterior inferior cerebellar artery. As you can look in this diagram, this is obviously the spinal cord. So the anterior spinal artery, as you can see, coming from very end of the artery, and the posterior spinal artery coming from very proximal into the vertebral artery. So all of these anterior spinal artery, posterior spinal artery will give radicular branch, which goes into the nerve roots. So these are the branches of the vertebral artery. So to summarize, we talked about vertebral artery, and we know that vertebral artery origin is coming from the subclavian artery, and in 10% of the patient, the right side will be hypoplastic. On 5%, the left side will be hypoplastic. And segments, we know that the segments of vertebral artery are 4, from V1 to V4. V1 is the prevertebral, and V2 are the foraminal, so inside the foramen, and V3, these are around the arch, and V4, this is the only intradural, and we know that it joins the other segment, the other vertebral artery, to form the basilar artery. And then branches. The branches of the vertebral artery, we talked about five branches. What's the most important? The posterior inferior cerebellar artery, which I'm going to explain in another video. And there is spinal branches, there is medullary branches, and finally, there is meningeal branches. So meningeal are anterior and posterior. Medullary is a single branch. Spinal are anterior and posterior branches, and finally are the posterior inferior cerebellar artery. Thank you very much.